Dr. Paul Fadale from University Orthopedics joining us here on WPRI now. And Doc, thanks so much for joining us again. We just spoke a couple weeks ago, and you join us throughout the year. Every time there's, big injury news and you can dissect it and break it down. We had to pull you back in just a few weeks later because we've got a guy now on injured reserve, and we've got a quarterback in Mac Jones who was roughed up in the week 1 loss Sunday in Miami. Let's start with the player that won't be with the Patriots now for at least 4 games. That's running back Ty Montgomery, the team placing him on IR on Tuesday. This is a guy that's had a crazy last month. You go from looking good in training camp, carted off the field preseason finale. 16 days later, he's active for the opener at Hard Rock Stadium, and now he's placed on IR. What do you think has transpired in the last few days for him to now miss such a key amount of time?
So we all have to guess after 10 seasons or whatever it's been in the NFL, we got some mileage on those joints and those knees are tired. So we know there has to be articular damage, lining into the knee joints wearing down, maybe or maybe not a meniscal tear in there too. He's got a nice contract. He's going to play. So even if they cart him out, he's going to do everything he can to get that knee better. Who knows? Medicine, rehab, maybe injections. He's feeling better. This is his time. He wants to play. And then he goes out again. And so now, perhaps, we don't know, the team says, we got some damage in there. We don't want to lose him for the season, but clearly this isn't working. This quick and back, this guy needs a little rest. He needs a little rehab, a little medicine, a little tincture of time. Let's reevaluate in 4 weeks. And then if he's not better, then maybe we got to do more aggressive treatment. So I think that what they're doing is just saying games 1 to 4, we just got to give it up a little bit and see where this knee goes. A lot of mileage on that joint.
Damian Harris led all running backs in that room with 22 snaps on Sunday. Ty Montgomery right behind him at 21. So there's going to be a lot of snaps that need to be replaced come next week in Pittsburgh. Most thought that there wasn't a good chance Montgomery would have been out there for week 1, considering what happened to him late in the preseason, especially that preseason finale. How do you think he even was able to get himself on the field in playing shape in the first place?
Again, I think we're getting down to late in the career. This is it. This is your time. This is your chance to shine. You and I have talked on camera and off how tough these guys are, brutally tough. So with a little treatment, we don't know what medicine was given, a little rehab in time, he's going to try to convince those coaches he's good to go. And in practices, he's looking pretty good. But we can't confuse practice with an NFL football game. So maybe you can fake him in practice, but once the game starts, now the injury starts piling up, and he probably just couldn't go anymore and said, all right, now I'm starting to do some damage on this joint. I got to get off this thing and let it rest. And so this may be great. If we can get through this, it will get him for the rest of the year.
All right, quarterback now. Mac Jones was roughed up Sunday in Miami in that week 1 loss. Today, Wednesday, September 14th at the podium, he told reporters in Foxborough that he's good to go. He's just keeping his back warm. And he was a full participant on the injury report that was released this afternoon. Why do you think that in the last 72 hours, he's gone from the x-ray room Sunday in Miami to now full pads practicing in the first practice this week on Wednesday?
There's probably nobody, Maury, listening to us who hasn't had back pain. Everybody has back pain. X-rays are uniformly normal. MRIs are uniformly normal. It's a black hole. Nobody knows where the pain's from, where it's going. Now the good news for everyone with back pain, 95% of patients get better with treatments and medicine, and they'll get better. We'll never really know where the it was or is in the back, but if they can keep them warm, keep them stretched out, keep the medication going, and not get the snot beat out of them over the weekend, that this has a great chance that this is going to get better over time. If not, the fear is it changes his mechanics of throwing. That is a huge problem because now he's altering the way he passes. So I'm sure they're going to make sure that his throwing mechanics are good and he can get through it. And then they just have to protect him. How do you protect the padded back? Pretty hard to do in pro football.
Yeah, we'll dive into the X's and the O's there with the throwing ability in just a minute. But I want to ask you, what types of tests did Mac Jones go through Monday, Tuesday, and Wednesday in order to get himself ready for practice? What did he clear from the doctor's side of things?
So I can guarantee you the x-ray, we have to do it. It showed nothing. He didn't break his back. You get an MRI, and as I alluded to, it almost uniformly shows not much at all. There's a little tiny wear and tear because you're a pro athlete. they're probably not going to get a CT scan if the MRI is normal. So the testing, unfortunately, is so frustrating because these kids hurt, we hurt, all of us hurt, and the MRI rarely comes up with anything specific. So then it's a matter of, can you stretch him out? How's his balance? How's his strength? How's his range of motion? Can he throw the ball or not? And so they got to put him through all these tests to say, yep, he's back. We don't know if they're going to put him on a steroid or just an anti-inflammatory medicine to calm this thing down. If he's excruciating pain, he's going to be on a steroid to push all that inflammation down to get him to play. It's a very common thing to do. Highly unlikely they would be using cortisone directly and anywhere in his back. Possible, but unlikely.
Is this around the clock treatment, Doc, for Jones in order to keep the back loose and warm so that he can stay mobile for Sunday?
I would bet, because what happens is, you and I both know, your back goes out. What does it do? It just tightens right down. And now you can't move. You can't move at all. And now they got to work for hours trying to get that thing stretched out again. So I bet you they're working them around the clock to get them there. And it's amazing because we've all been there where 3, 4, 5 days later, you're like, God, I can't believe how good I feel. We just don't know if he's going to be that guy come Pittsburgh.
All right, final one before we let you get out of here. What are some of the risks that the team and the franchise is taking by potentially putting him out there on Sunday?
Again, I think the chances are low that he's not going to break anything. It's pretty darn low. He's going to herniate a disc, something like that. It goes back to the black box of back pain. Nobody really knows where the generators are for pain. And so you don't want a 20-some-year-old young athlete with chronic low back pain. You just don't want that. Again, the fear is it changes the way he moves and throws the ball. So if they think that this is going to be a little bit of time before this thing comes down, cooler heads would prevail and say, maybe we got to sit this guy rather than get a further risk of irritating the black box. You and I both know if you have a knee injury, 98% of the time you can see it, deal with it, and fix it. Shoulders are similar, not so with back pain. It's the black box. You want this kid ready to go on Sunday. You don't want him going out there, quote, limping around, because this could turn worse quickly.
Mac Jones, a first-year captain in New England, coming off of a successful rookie season and wants to prove that he's a tough guy, that he can be out there and be relied upon because, as Bill Belichick says, the best ability is availability. That's Dr. Paul Fadale from University Orthopedics. We appreciate him hopping on, and you can expect to see him more throughout the season here in 2022.
Thank you, Maury. Be good.